Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. My esteemed viewers, welcome to another edition of COVID-19 update. And today our topic is COVID-19 and mental health pandemic. Um, as usual, this show is in English, but I will be summarizing every segment into Mandinka. I hope you all had a good weekend. I had a very, very good weekend. And Ramadan Kareem to all of you. We just witnessed the beginning, and I hope we finish it healthy and sound. Yeah, our topic today, as I said, is COVID-19 and mental health pandemic. I think the whole world now is concentrated on the physical health of the general population, and very little attention is shifted to tied to our mental health stage. And pandemic like what we are experiencing now, which in our lifetime we've never experienced, but we've seen smaller ones, the epidemic of SARS in 2002, MERS in 2012, and these kind of events during the time and also immediately after when it's over is followed by a tsunami of mental health crisis. So it's good that we mention this, and I have to make this clear. I'm a medical and molecular microbiologist by training. I'm not a mental health expert. So, but the figures I'm going to get here and the facts are well researched, um, and that's how they are in any credible literature. So, as usual, how we do these so we first start, because since it's about COVID-19, we first start with the figures, the statistics of COVID-19 so far, and then from there we go to the main topic. Yo mbadi wal ngal welcome al bunya to kumandi koreke yin so to mi alon kon ka fay COVID-19 daily updates. Yo sign yin sun karo kono time on tarale kabo kabo 1 hour kata half an hour. Yo mu womu wom sunkaro ñinna detolati min sunkaro tambita ɓe muruna notol to 1 hour, but even ñin sunkaro fanan kono desol dol di jembe ɓe jesnol soto la ninga jesnol soto mba sambala 1 hour le yo ñing is not amanke jadi kende adam mala sodi but environment component fanan di jele mi alon ko min sunkaro kono abinana le once in a while but min sunkaro tambita do fanan be regular le yo komi ko bi na diamo be kala min na topic ko wolo mu nin kuran covid-19 min ba kono nin ayen sonde me jati kende manya dibe yo nin kuran sifal ni nata duniya kono wato wati ida wato la walla na tambita mo jama bije ka sonde me sasa soto so mine ko sabu anin se mine keno kam fon tankandala mbe wala discourse la jang yo pour ka ko endal la fananko sonde me sasa woman kenna speciality di ntemu medical and molecular microbiologist wala ngole train yo barimbina fenko nombol min fela janin kuma kesol min fela jam mental health expert wala landi wala nyama kula mi alon ko ma kis le jannin kana jam so I'll say for you coming in so janning even though binna diamo kungo be kela nyin kuran walati anin na sonde me jadi kende yo bari mbe numbers non komi kadiri nyin kuran o starter ay momin nanga mo mutane momin nanga mo fa luwolu fongo folodi because wolom so nyin fenko. So in English quickly, so far since this COVID-19 pandemic started in Wuhan in China, according to what they told us in December 2019, even though there are increasing evidence that the Chinese might actually be grappling with this illness far longer than December 2019. But so far, what is clear, what they told us is that pandemic started in December 2019. So since then, 3 million Today we have another milestone: over 3 million people, 43,401 people got infected with this deadly virus, and 210,204 dead. 915,741 recovered from the illness so far, and right now 1,917,456 people are living with the illness. So the caller started. They won't wait until when we started. So, yeah. So far, 1,917,456 people are currently dealing with COVID-19 infection, and out of that, people living with 19, 1,861 and 73 people are in mild condition. That is 97% of the total number of people with COVID-19. And that is 97% of people living COVID-19. So when they say mild condition are people, some of these group don't even know they have COVID-19. Others will have mild symptoms like headache, persistent cough, unproductive, that you cough but you don't bring anything out, and also fever. But in other instances, there are people who will experience loss of sense of smell and taste, and others will feel will experience diarrhea. And now, right now, just last week, another symptom was added to it called COVID-19 toe. That means you have a blister on your toes. It's a sign that you might be having COVID-19. So out of the total number of people with COVID-19 across the world, 56,383 people are in serious or critical condition. Okay, these are the groups that really the world should be worried about, and this is the group that contribute mainly to the daily death toll or daily mortality we've seen. 56,383 people, these serious or critically ill people with COVID-19 cannot breathe for themselves. So that's why they go to hospital, because as you are all aware, up to now, these deadly virus have no cure. There is no medication for it. So, but if there is no cure, why people go to hospitals? People go to hospital because what COVID-19 does, how it affects us and how it kills us, it damages our lungs. And it is through our lungs we can exchange air, that is oxygen and carbon dioxide. We inhale in oxygen and bring out carbon dioxide, because buildup of carbon dioxide in our system will make us ill. But also, if we don't have enough oxygen, which is 75% concentration in our blood, we become ill. Our other vital organs become starved of oxygen. That's what is called hypoxic. If your vital organs like the kidney, like the heart, like the brain, or the liver, don't have enough oxygen, they become to die, and that's how the virus actually eventually kill people. So when critically ill or seriously ill people go to the hospital, what the doctors will do, they will use mechanical ventilators to help them to breathe. But also, it does not matter how sick you are, you still need energy. So they also give them glucose drips. This will give them energy to keep brain functions and other vital organs. And also they will need fluid like water. So they also give them drips with water so that they can continue to have their water supply. So in Mandinka, kabirin kurang yung kumasa December karo kono 2019 komi ko Chinese ole min fonne yo bari kol be fondi kan nyamin kol be wanyar kan do mandino mandinga seke kurang yin kumasta wato min na China a manke December janin December ka silom yo bari yunube be koylar as time goes on. Yo bari kabirin kurang yin funda China in December kana sign 3 million people, more million saba, more wuli taw nanin saba, more kemenana ninkin wale kurang yin soro, more min nanga mo fata dada, more wuli keme fula, more wuli tang, keme fula ani monane. Yo mol min yalan ko kurang yin soro bari kende ato obe more wuli konanto, more wuli keme konanto, wuli tan nin dunu, keme worola tan nani nin killing. Yo ñunumi yalon koye courant soto molbe debate kan WHO until kunun ko iko imalla fo ñunube immunity soto la komi ko ni courant soto e balo ka ila balo la sojaro dolle ta yi programme min yanke ke programme le specifically ko courant ñing attack like COVID-19 be ñamin min yalon koye courant ñin soto i balo e sojaro programme ne mi yalon ko COVID-19 kelendi fayano and wol programme ngol be balo kono fokado. So ñim mo wulu keme kononto mo wuli tan ni mulu keme worola anin tan nan nin kine wolbe damin wol balo e sojaro sodo mini an ko they are fully programmed ni COVID-19 encounter ko de kerek ati landile wo baro la sojaro be wulla rek ye replicate ye multiply rek ye courant min attack so ka fully immunity. You know, Angalelia suggestion earlier Kabiri la latest intervention on you introduce ikebe certificate or deal among the mini alonko ikende ata courant mine ka fa immunity certificate so that he wole tala kata do ko and dun jikita ko nyinne be kala new normal design iba jala ko hanin tata kanna visa la apply walle la tala banku do ibe nyin immunity passport o ni ba nyin kala ni ma sodo iba fule ko e penkota. So mon min alon ko ibe penko la ko jawyandi le ba fenkala mo le penko ko ngota dia ko ya because woda male saatin na kuran ni ay adduno e kunduno so iba jara ko kabo sain kata nin tama silo li leta don iba jara ko bankol be nyinin karo kela yeta ila banko min ka yeta ila yelo ko jibe fo nyin COVID-19 sojarol min alon ko ibalo le programme pour ka ta febe balo kono febe yelo kono ban ta natije iba fele ye penko ta o penko fane de certificate o dire la pour ni vite la visa apply wala min visa te ni molte ni tata la airport o te fo certificate o tandi ni ma tandi te sonne dum min manke luwati barin kita ko wo kala is going to be new normal so pour mbe en pare o kam yo in English, the top 10 affected countries. I'm going to read the figures to you in English, then after in Mandinka. Past 24 hours, these are figures for the past 24 hours countries most affected, the 10 top countries most affected, but also I'll give you figures for West Africa. These are countries very, very close to Gambia, which make us very, very, very vulnerable to explosion of this pandemic. And according to WHO estimates, around West Africa will peak. You know, the rate of infection will peak in West Africa around June, July. So that's like a couple of months away from now. So, but past 24 hours, America recorded 12,230 new cases, 762 deaths. Spain recorded 2,793 new cases, 331 deaths. Italy recorded 1,739, 333 deaths. And France recorded 3,742 new cases and 437 deaths. Germany recorded 443 new cases, 45 deaths. UK recorded 4,309 new cases and 360 deaths. Turkey recorded 2,131 new cases, 95 deaths. Iran recorded 991 new cases, 96 deaths. And Russia recorded 6,198 new cases, 47 deaths. China recorded 3 new cases and 1 death. Brazil recorded 469 new cases and 27 deaths. So in Mandinka quickly, your new number min kan idea la wolom number so to mini alonko bankuta wol min yin kuran wol lokuta wol la dunia be kono ya bol kono America non 24 hours min tambita mo wuli tan min fula mo kema fula nin kan sa wole kuran min soto yo mo kema worola taw woro nin fula fada Spain banko ka wolu nin 24 hours min tambita mo wuli fula keme warola tan konontonin sabole kuran so mo keme sabatan sabanin killing wol fada Italy mo wuli killing keme warola tan sabanin kononto wole kuran so mo keme sabatan sabanin saba fada France mo wuli saba mo keme warola tan nanin wole kuran so mo keme nani tan sabanin warola fada Germany banko ka mo keme nani tan tan nan nin saba wole courant min sodo mo tan nan nin lulu fata Angleterre UK mo wuli nani keme saba anin konontole courant min sodo mo keme saba tan ɗawo fata yo toki mo wuli fula kemme killing tan sawanin kili wole courant min soɗo ñin 24 hours min tambita mo tan kononto min lolu fata iran mo keme kononto tan kononto min killing wole courant min soɗo mo tan kononto ni woro fata yo russia mo wuli woro mo keme tan sayi tan kononto min sey wole courant min soɗo mo tan namin woro wula fata China mo sabale courant min soɗo mo killing fata ñin 24 hours min tambita Brazil mo kemenani taw woro nin kononto wole courant min soɗo mo mon woro wula fata yo if you come to the countries surrounding Gambia, that is Senegal, Guinea-Bissau, Guinea Conakry, Burkina Faso, Ivory Coast, Mali, and Sierra Leone. I will start including Mauritania as well. So Senegal, so far, they have registered 736 COVID-19 cases. Just past 24 hours alone, they recorded 65 new cases. Guinea Conakry now is leading in West Africa, is leading almost no second leading in ECOWAS region, and only 3 weeks ago they have their first cases. So it just looks like the referendum they've been to earlier in the month is turning out to be a very, very ill-advised move for them to do, because the figures just keep increasing. So Guinea have 996 new cases so far. Guinea-Bissau have 53 cases, one death, and Burkina Faso have 632 cases registered so far. Ivory Coast now is leading in West Africa. Sorry, I forgot Cameroon. Cameroon also, but these are regions that are very, very accessible to the Gambia. I have to be frank. That is 1,150 cases so far. Mali registered 389 cases, and Sierra Leone also registered 93 cases. Gambia is still stuck at 10. I hope it stays like that, but I don't believe those are the right figures. So now I'm going to today's topic, which is COVID-19 and mental health pandemic. Any news about the corona outbreak continue to dominate the headlines. As you all agree, right now you can't watch any other news. There's no sports. There's no other news. Very, very little news about war. Even wars been taking place now. This COVID-19 take them all off the news headlines. So we have been asked to quarantine, that is to observe physical distancing. I don't know why WHO continue to call this social distancing, but I think it's a wrong description. I think the most appropriate is physical distancing, because even when we are far apart, when we are physically miles, like thousands of miles away, like right now I'm interacting with you people socially. We can connect with our social media, different social media platforms. But physical distancing, I think, is more appropriate time. And they ask us once the advice comes that we should stay at home as much as possible, just to cut the chain of transmission. So and also lot of attention is being paid to our physical health. But right now our biggest challenge is not actually our physical health, but our mental health as well. Mental health also should not be underestimated. So pandemics such as the one are currently grappling with often infinite fear. Everybody is fearful. You go to work, you don't even trust your colleagues at work. You don't know who is carrying the virus. Nobody cannot even sneeze. You feel like the urge to sneeze. But if you sneeze, the way people will look at you, you tend to hold it. So, right now we are all grappling with ignite fear anxiety and erratic behaviors. So um, this is real. This is what is happening when fear takes control. Both our nervous system and emotional part of our brain goes into overdrive. Right now our brains are working. You go to bed, you can't sleep because your brain will start replaying where you've been, what you touch. That guy in the supermarket next to you who sneezes, maybe you catch it. So these are the mental health issues. Um, 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 these can make us not to sleep properly. So it really is a dilemma, and rightly, we should all try and put it in, give this very important component of our well-being, the attention it deserves. So, as I said, pandemics like this, our brains go into emotional part of our brain goes into overdrive, and this response can lead to impulsiveness. People tend to be erratic, they tend to be short-tempered, and they generally people are fearful of each other. So this is followed by panic and feeling out of control emotionally. So, if a person has a pre-existing mental illness, for example, or history with anxiety and depression, we all go through bout of depression or anxiety sometimes in our life. But for some people, is chronic, is an illness, and so pandemic like this, can worsen or intensify during times such as this. And if threat and anxiety worsen, then it may trigger negative physical symptoms, such as an elevated heart rate. If you, of course, if you are fearful, your heart rate will go up, and you tend to sleep less. And these can also even cause issues with your digestive systems. And you become weak and fatigued, because if you don't sleep well, you go to work, you feel tired. The following day, daytime, you don't feel like working. So these are all symptoms of anxiety and depressions. In the morning, you are not at your bed, you don't feel like coming out of your bed. So these are some of the physical conditions that associated with mental health issues. And if you've been feeling anxious, frustrated, or angry, or downright confused lately, know that you are not alone. We are all in this together. Nobody will tell you, well, I'm indifferent, especially except for some section of youth who can still afford to go for picnic in Gunjur, my native town. I find that very strange, and I don't know what kind of human being these people are. They still have time to go and socialize, and nothing, you know is going on. So this is a new poll from the PSA Family Foundation found that nearly half of respondents saying that their mental health was being harmed by the corona pandemic. So nearly everyone on this planet is experiencing varying degree of grief, panic, hopelessness, and paralyzing fear. So this paralyzing fear can be the fear of catching the virus, or it can be the fear of losing your job, fear of losing a loved one, fear of losing a business. So, it depends which, side of the spectrum we are. But it's normal for people to be fearful, but if that fear is not controlled, this can lead to serious mental issues. So we will come to the solutions, but I don't think we will reach that. We continue this tomorrow, inshallah, because we are running out of time. We are coming to 5 minutes before. So just for you to know, tomorrow we will continue this particular topic where we stop. So, as I said, nearly everyone on this planet is experiencing varying degrees of grief, panic, hopelessness, paralyzing fear. And if you say now that how terrified you are, the most common response you will get is, what sensible man is it? Person is it? Everybody is. So, but this respondents are registered who express these symptoms of depression or mental health issues. You know, we shouldn't make us lose sight of the dangerous secondary crisis unfolding alongside the more obvious one, an exhalation in both short-term and long-term clinical mental illness that may endure for decades after the pandemic recedes. When everyone is experiencing depression and anxiety, real clinical mental illness can get erased. Right now, everybody is suffering from some degree of mental health issues. So that alone will put the real those people with actual serious mental health issues become less important because everybody is in the same boat now. So this is another secondary implication of the mental health pandemic we are all experiencing. People with chronic mental health problem now become less important to either their caregivers or to the medical fraternity. And also, lot of effort is being put into our physical health. You know, lot of millions. You know, lot of effort is being put, but very little is catered for mental health issue, which is very dangerous. And the earlier the world come to the realization, the better. So while both the federal and local government have responded to the threat of the coronavirus in critical ways, acknowledgement of the mental illness vulnerability has been hastily. Okay, the New York, that's my man. You know, he's the man of the moment, New York governor. I think, you know, he got the grasp of this virus and very early, and he's giving it all the attention and the virus deserves, unlike his boss, Donald Trump, who haven't got a clue, in fact, what is going on, you know, around him. So Andrew Cuomo, who has a far enlisted more than 8,000 mental health providers to help New Yorkers in distress, is a fortunate and much welcome exception. So this guy, you know, should be mentioned. You know, he's not only putting money into our physical well-being, that is make sure the hospital are all equipped with the right number of ventilators and they have right number of medical personnel. But also he come up with these 8,000 mental health providers to help New Yorkers in distress, and this is timely and needed. So the Chinese government also moved psychologists and psychiatrists to Wuhan during the first stage of self-quarantine, and no compare measures have been initiated by our many governments either in Europe or in America. So today, this is what we have for you. Inshallah, tomorrow we will continue from where we stopped today. And thank you all for coming for your time and watching. And I ask of you to please share these videos. This will help us our message get to as many people as possible.